Okay, so here we are in August of 2020. I think a lot of us feel like the second wave is coming soon. Kind of our data apparatus is falling apart a little bit. But while we try to wait and figure out what's happening now, let's take this time to go back because I don't think that we've really had time to process what happened over the past 5 months yet. So this is a short series of videos that we're just going to look at the data from the first wave of COVID in Denton County, and we're going to tell the story of the pandemic thus far. Okay, so this first one is the very first bump. This is late winter, early spring of 2020. So during this time period, I had really kind of 4 pieces of data that we're going to look at. So one is new cases. These are the cases that are announced every day. They're reported by Denton County Public Health, and they're arranged by announcement date. Now, what's special about the Denton County numbers is that Denton County also provides the onset date for their cases, for new cases. So the onset date is the day that that person started feeling sick. That's a really crucial a piece of information because that lets us start to build a timeline of when people are getting ill in Denton County. Now, there's a third piece of data, exposure, that is calculated using onset, okay? So we know that people are likely to have come in contact with the virus 2 to 14 days before they start showing symptoms. So we can start to build a probability cloud of when we think people may have been exposed to the virus. That's going to be really interesting to us because we want to know when community spread was highest, right? We want to know what that environment looked like, what the situation was that led to a bunch of people catching COVID. So we've got that. And then the fourth piece of data is deaths. And this is deaths by death certificate data, which has become available from the Department of State Health Services. Now, deaths are a lagging indicator. So that means that when Denton County announces a death, that person probably died a week to 2 or 3 weeks before at this point. What this new data from DSHS lets us do is look at the actual days people were dying back in the beginning of the pandemic, and we can start to build a true timeline of what this disease looks like as it kind of washes through our community. So I want to make it really clear what I mean by new cases, onset, and exposure. So what we're looking at here is the 133 new cases from August 17th. Now, these 133 cases represent only the symptomatic people who were counted on August 17th. Currently, and through the entire pandemic, the vast majority of cases reported by Denton County Public Health have symptom data associated with them, okay? But obviously, if you don't have symptoms, you don't have symptom data, you're not actually in this chart, but that's okay. So all of these cases were announced. All 133 cases were announced on August 17th, but the red bars show when people actually started feeling ill. And so many of the cases that were made public on August 17th started feeling ill back in June. All right? So the first thing you can see here is that the cases that we're getting today are history. They're historic, okay? And they could have happened. It could have started getting ill anytime pretty much in the entire summer. So this is the critical concept of this first video. Today's test results are not reflective of today's disease environment, okay? Today's test results may be reflecting the situation a long time ago. And in addition to that, today's test results cannot be directly traced to any one day or any one event in the past, right? That big dispersion we can't say, I've seen this over and over and over. People say, oh, well, that's the 4th of July cases coming in. Oh, well, that's the Memorial Day cases coming in. That's not how it works, right? We cannot say that these cases announced on August 17th were from any particular time in the summer, okay? So we can't do that, okay? These numbers do not reflect the situation outside today, and these numbers do not reflect the situation at any one time point in the past. These are two huge limitations of our testing data and two of the biggest misunderstandings of kind of the number jockeys that sit there and look at the numbers every day and think that a little increase or a little decrease over the course of a day really means something. It doesn't mean anything when you have this much error in the data, okay? So, this is the same chart, but now I've added the exposure cloud, okay? So the blue curve, never mind. The blue curve is exposure, and it's been calculated from those red numbers, right? And so what you can see is for the people that were announced on August 17th, they may have gotten ill anytime between mid-August and early June, okay? The COVID timeline is a long and wide timeline with a lot of variation in it. Again, you cannot trace this to one exposure event. It's even bimodal from mid-June and then again in mid-July. Like, it doesn't, you cannot try to draw those conclusions from one day's testing data, okay? Now, what I have done is taken all of the days, right, for the first part of the pandemic and plotted these curves. So exposure, onset, new cases, and deaths, okay? So this is the exposure curve for the first wave, okay? It peaks around March 15th, but the low probabilities extend even into late February, okay? So in late February, we get the first evidence of community transmission in the United States, okay? So let's kind of remember what this timeline was like going through February and March. The last day of February, we get the first COVID death in the United States. So people are starting to take this more seriously. During February, Lackland Air Force Base in Central South Texas was being used as a quarantine for Americans who had been evacuated from China or other places. And by March 1st, San Antonio was banning these cleared COVID patients from entering the city. They were suing the CDC over some Lackland Air Force Base safety stuff. So people in Texas were starting to get really concerned about this. We now know that on March 4th, the first Denton resident, our local patient 0, started feeling ill with COVID, okay? This person picked it up traveling and brought it back. So this is also the same day that Texas reported their first case that wasn't related to Lackland Air Force Base out in, I think, Fort Bend County. So the first time you're starting to see, oh, maybe we have COVID, and it's not just these people who have been evacuated from China. March 6th, South by Southwest was canceled. I remember that was a big deal, okay? And a lot of people felt like that was an overreaction. They were surprised that it happened so fast. But look at the exposure curve. We're already halfway up a really sharp incline in exposure probabilities. Now, let me be very clear. What is the unit over here, the 0 through 1? I have normalized all of the data so that 0 is the lowest value of whatever it is. So blue is exposure, which would be probability of people exposed. Red is onset, which would be number of people who get sick. But 1 here, because it's a normalized scale, is the highest observed value of any of these, so that the peaks all match, okay? So don't try to interpret it as like, one, it's 100%. 1 is basically 100% maximum exposure or maximum onset. That's just so that they match, because they all have different, units. So March 6th, South by Southwest canceled. Then we start UNTTW spring break. Okay. So yes, COVID was in the community. Yes, it was spreading while we were still in school before spring break started. By March 11th, okay, this was a big day. Most of the Texas universities go online. The Houston Rodeo was canceled, which is big. And we had official confirmation of community transmission in Texas. At this point, look at the exposure probabilities. They start to slow down, okay? We haven't gotten to any really government interventions. We haven't had a shutdown. We haven't anything like that yet, but the exposure rate is slowing down. It's slowing down because people are starting to behave differently, okay? By March 13th, Governor Abbott declares a state of emergency, and by March 15th, we've implemented social distancing. March 15th is the peak of exposure for the first wave, or first bump, okay? This is also the day that we get the first confirmed case of COVID in Denton County and the first COVID death in Texas. This is the day people start taking this seriously. I remember this is also the last day I was in a restaurant or bar in Denton County. And it was weird. It was already very empty, social distance. There was a lot of sanitizing. And then I remember as people started to come into this patio area we felt really uncomfortable, okay? So by this point, even though it's not mandatory, we have already seen quite a change in social behavior. By March 17th, St. Patrick's Day, many bars and restaurant dining rooms are already closed, okay? So Oak Street, Harvest House, East Side, they were already closed. Chick-fil-A, McDonald's, they already had their dining rooms closed. There were not that many bars actually open on St. Patrick's Day. Again, nothing has been declared, mandated. This is people voluntarily doing the right thing to stop COVID. And it's working. Now, on the 19th, we get the hard shutdown. Now we get Texas closing, the bars, the restaurants, the schools, okay? And from then on, you do see that exposure starts to drop. But the other thing you can see is that new cases, this purple, are starting to increase and increase rapidly. And so I argue that as new cases increase like this, people change their behavior and they become more careful, and we see exposure drop. March 20th, the first person in Denton County dies of COVID, but we don't know that for 6 days as the public, okay? It's not until March 23rd that we get our stay-at-home order, okay? By this point, we're getting a lot of people feeling ill, but exposure has already dropped quite a bit. This is also the same day as the notorious Lieutenant Governor interview where he suggests that grandparents are willing to die for the economy. We get our first COVID death announced by March 27th, okay? And essentially at the end of March, beginning of April, this is like the hardcore, most serious shutdown situation that we had, okay? And so you had Abbott telling us if you're not engaged in essential service or activity, you need to be at home to slow COVID, okay? This is what we're being told as cases are going up and deaths are going up. Now what's interesting is that it's not until April 3rd that the CDC recommends cloth face coverings, okay? So we basically went through the entire exposure period of the first bump without face masks. So I need you to understand this, that masks are not what ended the first bump, okay? Masks are not the only thing that you can do to get at COVID. And frankly, they may not be the most effective. They still can help. Wear one. I'm not at all an anti-masker. But my point here is that I do believe that masks give people a false sense of security. And I do think that they have been used for months now as the get out of jail free card. And they are not at all. Okay? So on April 8th, we get our peak new cases, okay? Now this is 16 days after peak symptom onset. So these cases are being announced about 16 days after people feel sick, which that would, of course, include the time it took the person to go get tested, for those test results to come back, and then for them to get reported. So that's that timeline. The peak new cases are almost a month after peak exposure. So here's what I need you to understand is that we are always going to be behind what's actually going on. And our goal is to reduce that as much as we can, but we can never reduce it more than maybe 2 weeks. So please understand this, that this timeline is not real time, okay? We are always behind. We are always blind to the situation currently. That's just the nature of the data that we have. Deaths followed just 2 days after peak new case report, okay? So again, these purple is the report of new cases, not actually people getting sick. People are getting sick back in the blue and the red, okay? They're just being reported in the purple, and they're dying in the pink, okay? So we can expect that about 28 days after peak exposure, we see the deaths peak, all right? So if I take away the deaths and the new cases so we can go back and see what exposure looks like, we've got a problem, because even though mortality is peaking there on April 10th, our exposure risk is going back up. So why? Why is our exposure risk going back up? What does that mean? What is that? Well, that's the second video, okay? And that is going to talk about the echo ripple. So I will see you then.